Welcome to another part in our series, Feeling Some Kind of Way, an honest talk about our emotions. My name is Leslie, and I am a writer and content producer for Push Black. And today we have two stellar guests with us. Y'all, we're about to get into some real things. It's about to be a beautiful conversation today. And welcome to everybody listening, because this could really be something that could just really change the trajectory of our lives today. One of our first guests is Dr. Neal Barnett. She's a national award-winning psychologist, professor, and leading expert on in anxiety orders among Black Americans. All right, y'all know, we know. She was the first African-American woman to be tenured and promoted to the rank of full professor in Kent State University's Department of Psychological Sciences and in the College of Arts and Sciences. She directs the program for research on anxiety disorders among African-Americans. And her current work is focusing on Sisters Offering Support, which is sister circles for anxiety across the lifespan, and the role of race and stress in Black infant mortality. So Dr. Angela, welcome. We are so glad to have you with us today.
I am so glad to be here, Leslie.
Thank you, thank you. Our next guest, Camille Tenerife. Camille, did I get your last name
Tenerife.
right?
Yeah, close. Tenerife.
Tenerife, I do apologize. Tenerife, it is really important, y'all, that we, honor and get names correct. So I do apologize for that. That's my Mississippi coming out, honey. I'm gonna do the best to keep it in. But Camille is a licensed marriage and family therapist, and she's located in Beverly Hills, California. She received her Bachelor of Arts degree in psychology from San Jose State University and her master's in marriage and family therapy from the University of Southern California. She's dedicated her career in working with clients in minoritized populations. She specializes in working with professionals, especially those who identify with the Black community. A lot of the challenges her clients face are surrounding identity and race-related trauma. And many of her clients who sit across from her experience various types of discrimination, microaggressions, or racism that heavily impacts their ability to do their absolute best. She also supports individuals in navigating traumatic experiences that may get in the way of developing and maintaining long-lasting relationships. Welcome, welcome, welcome again, y'all.
Thank you.
So let's just hop right in. I guess there's no tender way to do it. Let's just belly flop into this pool of emotions and Black people and how we handle our emotions. So we know that enslavement really changed our emotional health. Because it's not like we ever, had therapy coming out of enslavement. So how did enslaved Black people deal with emotions? Like, what can you say anything about the history, or what were some of the coping mechanisms? And that's
sure. Actually, there's a wonderful book as it relates to Black women and slavery, Stolen Women, by Gail Wyatt, Dr. Gail Wyatt out of UCLA, that actually talks about this. Remember that to express any kind of emotion was often seen as being sassing back or talking back or being a difficult slave. Slaves who did not want to be slaves and ran away were actually given a psychological diagnosis. There's a whole, there's a psychiatrist back in the antebellum period, Dr. Samuel Cartwright, who wrote about drapetomania, which is runaway slave psychosis. Because why on earth would a slave want to run away? So part of getting through enslavement was burying your emotions deep down and burying any kind of trauma that had happened to you. So we know we know that there is this history of this. And then as we go on further, we'll talk about some of these stereotypes that have arisen that are also around how Black Americans handle their emotions.
Thank you.
Yeah, and I want to just add to that too. It was functional, right? It was functional to be able to suppress our emotions. So one of the ways that Black people, and this is passed on through generations now, one of the ways that we manage our emotions is to compartmentalize. Right? Let me deal with this later on, because right now it is more dangerous for me to bring this up in the surface. And sometimes this happens all subconsciously, not even in the conscious effort.
Camille, I'm so glad you said that, because as you were speaking, it reminded me of that poem by Paul Laurence Dunbar, We Wear the Mask. And that speaks to that compartmentalization that Camille so eloquently spoke to.
Wow. Wow, that's a lot to process. And knowing that we still carry it today. So Camille, you said a little bit about, how one of the things we do as coping mechanisms is to compartmentalize.
Mm-hmm.
What are some other ways that that history of enslavement, where Dr. Angela just pointed out, like, we had to do this to survive. This was a way of being good, and to think that if we just wanted freedom and to be human beings, we were seen to have a mental illness. I mean, that's a lot to carry as a people. That's a lot to hear.
Mm-hmm.
So what are some of the ways some other ways that impacts how Black people deal with emotions now?
Yeah, I think that we don't necessarily get the space to explore these emotions even more. And then we don't necessarily have the language to express what this means if we're not given the tools and the space to have these conversations. Oftentimes what happens is, I think what Dr. Angela had mentioned, is that mask, right? That mask that we put on. It is exhausting to have to put on a mask and also deliver whatever our responsibilities are, whether it's work, whether it's being a parent, whether it is being a friend, whatever it may be. So it makes it so much more difficult to process these emotions when we're always, again, subconsciously or consciously putting them to the side. Another kind of coping mechanism that isn't necessarily always healthy, but it is functional, is that what we heard about code switching. Right, where we change our behaviors in exchange for being able to be accepted, to being able to belong, right? And so some of that within that code switching that happens for a lot of Black people in different spaces, it makes it even more difficult to be ourselves. Then there isn't that space to process those emotions.
So okay, so that's enslavement. And I know one of the things that we've done in our research in Push Black is we've done some talking with the Black church. We've even talked about the Black church here. And one of the things that came out in one of our lives is that the Black church was often one tiny space where some of those emotions were practice. So let me kind of like push back, yes, push back a little and challenge something. Dr. Angela mentioned We Wear the Mask by Paul Laurence Dunbar, and in the last stanza of that, there he's saying that we're smiling, and he sort of cries out to God, and he's saying that we're singing and we're standing on this vile clay, and we just let the world dream on, and but we still have to continue the mask. So when we think about that and we think about the Black church, there are some people who might say, okay, so that was enslavement, and it was hard, it was horrible, but now we're Christians, and based on the Bible says sort of the same thing that we were doing when we were oppressed, that we should be slow to anger, that we should forgive those who hurt us, and just hand over our problems to God. Could it be that maybe some of the things we're feeling are not so much from enslavement, but rather just our own spiritual issues?
Well, I think there are a couple of things to say here, because we just started in terms of compartmentalizing and pushing down those emotions, but there are other ways that we express our emotions. And I'm glad you mentioned the Black church, because remember that initially that the Bible was used to keep Black people enslaved, but we are told to be Christians and we turn the other cheek and all of that, and that may play a role. But remember that Wednesday night and Sunday morning are ways for Black people to express, let out that emotion from the week. So that's why so many Black denominations are so demonstrative. You're singing the praise and worship, and people get the Holy Spirit, and they start dancing, and they start shouting, and they start running up and down the aisles in some denominations. Or in other denominations, they're just standing up with their hands lifted and tears running down their face, because it's a safe space to express your emotion. Now, remember, we've gone from being enslaved to freedom. And that then gets us to other types of ways that Black Americans express their emotions and stereotypes. So we're uppity, right? We're bougie, we're angry, okay? And all of us have been in the workspace where a Black woman has read somebody up one side and down the other, okay? And that's an expression of emotion. Or we heard someone say about a Black male, well, he doesn't know his place. Yeah. We look at our athletes, and when they express emotion, then we get white America saying all sorts of awful things about them, stick to dribbling. So it's not so that while on the one hand we compartmentalize and press down, on the other hand, we express and we are demonstrative, and the majority tells us that this is wrong.
I really like that you said that, Dr. Angela, because oftentimes what I tell my clients, if you don't express it in your words, you express it in your behaviors. Even if you don't say it, you say it, right? With your body language or the way that you roll your eyes or look a certain way or your anything, so that definitely, because we're emotional creatures, right? And as human beings, we're emotional creatures. So it is one way or another, it's going to come out.
Camille, thank you for saying that. Thank you for saying that we are emotional creatures. I think that it's really important that we kind of explore that a little bit. Sometimes there may be times when that's really looked upon in a bad way, to be emotional. And so we know one of the things you do is work with really high achievers and work with a lot of professionals in spaces. Can you say more about, I guess what I'm asking you is, give us permission to be emotional creatures. Say more about that. Will you ground us in that a little bit? Because I can tell you from personal experiences, like in my past, before I came to Push Black, there was a time when you're holding it in, you're trying to be professional, you have all of these microaggressions coming against you, and then there just comes a moment where you're sitting in the meeting and somebody says something, and instead of just nodding or taking your notes, it's all over your face. It's deep sighing, it's shifting in the chair, it's it's little comments where that emotions come. And of course, people are going to say, oh, that's so unprofessional, or girl, you should have held that in, will you say more about us being emotional creatures?
Yes, of course. We have emotions, we are born with emotions. And so that's what, separates us a lot from being kind of in the top of the food chain. And we're critical thinkers, and that includes our emotions as well. So I guess first want to say, I love that you said give permission, right? I think that starts with giving ourselves. We have to give ourselves permission to have those emotions and to express them. It is always difficult. I agree with you, because it may not be the right setting, or you have these rules in your head, or things that were shared to you by your parents or family members of rules and laws on how to express your emotion. And so you've really held on to them. So it really makes it hard there's this challenge between what your brain is telling you and what your emotions are also saying. So I want to acknowledge that it is difficult for a lot of people. And also, I think that another piece is once we acknowledge that we do have those emotions, is to turn inward and to ask ourselves what's really going on for me. And then be able to express them wherever, whatever feels appropriate. Whether that is in the workplace, how do I express that, a coworker or somebody said something that was that was a microaggression. Now, I want to preface that with saying, check in with our energy levels first. It's not always our job to communicate with other people how we're feeling, or if we're teaching them what is a microaggression and what not. That's not always our responsibility. So I would check in with ourselves first. But either way, I say that our emotions are our internal GPS. They help us in navigating what's going on. So instead of labeling them as good or bad, it's information. So now what is anger telling us? What is sadness telling us? What is frustration, happiness, joy, all of those things? What are communicating to us? Once you've explored that with yourself, then you can also share that with other people. It's also our response for relationships that we care about. It's a common thing that I tell my clients as well, is that it's our job to tell people how to treat us. And it's our job to teach people how to treat us. And one way to do it is through understanding and being attuned to our emotions. Hey, I don't like that you said it that way. If a friend means something and says it as a joke, right? Or if a professor says something and it didn't necessarily land well. So those are ways that kind of our emotions can guide us in having better relationships, being in better places, and healthy environments as well.
Thank you so much. So let's sort of shift gears here. So like today, both of you are therapists. Both of you work in helping heal Black people and helping heal emotions. It seems like, however, we're just now getting into a movement where we're seeing more Black people actually going into therapy, sort of lifting the stigma around therapy. When did this start? Like, when did Black people just start saying, okay, enough is enough, I'm gonna go get therapy, I'm gonna do this? Was there some type of like tipping point where Black people really just, it looks like a movement? Was there some type of tipping point, or is this something that we've always done and maybe just never talked about it?
I think there are two answers to that. One of the things we saw that happened after the murder of George Floyd was people could no longer contain their emotion, and they couldn't, and so it was spilling over into many areas of their life, and they were saying, oh, no, I have to seek help. I think the other part that we see is that over the last 10 years that people have been more open talking about therapy, and people who other people admire. So Jay-Z talking about therapy, stream shows where one of the Black characters has a counselor or has a therapist. And then there's been a lot of talk about social emotional learning and being able to, as Camille talked about, what is it that I'm feeling and labeling that emotion. And just the fact is, right now, to be Black in America, whether you're seeing a therapist or doing self-care or doing mindfulness, what's the song? If you're not, then we're all gonna lose our minds up in here. And so it's, it is, as I said all these things, but also I think it's our realization that for self-preservation, to live the lives that we want to live, that we know that we deserve to live, then we may need a little extra emotional help. And that emotional help comes from therapy in all of its forms.
I don't have too much research to back this up, but I'm going to talk about it as a millennial. But I think the rise of social media really helps in getting the word out there and people talking about mental health and therapists being more vocal or expressing, things that other people or people who want to go to therapy they're adding the words, they're putting in the words for people. And so when that resonates for somebody who's seeing a therapist speak about it, right, then that inclines them they're more inclined to go into therapy. It's also seeing, I think the hard part of it was therapy was started with European white men. And so that's another thing that we want to say, and that there isn't as much cultural competency in therapy. So I think now that, if there are more therapists of color or Black therapists specifically, then that can help a client say, hey, I can identify with that person, right? So I am now more likely to be open to it and get curious about the possibility of me seeking out therapy.
And Camille, there is research that says that.
Great. Yeah. Okay.
That's the perk of being on with a professor. That there is research that says that, and that you get, you get things like the Black mental health wellness lounge, or you get therapy for Black men or therapy for Black girls, and all of those kinds of all of those help a certain segment of the population, because they do see these therapists are people who look like me, and particularly those who are consistent on social media make an impact.
So what about, there's some generations that still maybe feel like, okay, so that sounds good, that's younger people, but I grew up in a time where I didn't put anybody in my business. Or I grew up in a time where, I didn't want anybody to see me crazy, as crazy. Can you all speak more to a little bit about where this stigmatization came from, and why there might still be people who are reluctant or resistant to seeking therapy or emotional support?
Two things kind of come up for me. One is that we have in the field of therapy and in mental health, we have a book, a textbook called the DSM. And that is basically lists all the diagnoses, mental health diagnoses. And it's continuously being changed and updated over time as there's more research and we find out more information about mental health. But the thing is, I just want to kind of validate people who sometimes think, I associate mental health with crazy, is that some of these things were also put in those books, right? I think in the past it happened to be even people who identify as LGBT as part of a mental health diagnosis, when in reality it isn't. So I think that as more information comes out and the more knowledge we have, the better equipped we are to make decisions about going to therapy and whatnot, and normalize a human experience rather than place a label and a diagnosis to that. So that's kind of the first piece. But in the second piece as well, I think that it is also understanding, maybe a lack of understanding of therapy and what it is, and maybe have some preconceived notions of what therapy is. And I would get a diagnosis, and then people, or I would get put into a mental institution and so on. And there's also negative connotations with that. And what I mean by that is sometimes, I've had a lot of clients who had to go get checked in hospitals, and treatment there isn't necessarily always the best. So that also information gets passed along. So I think that there's still work in the mental health field that we need to kind of address and work through. But at the same time, information, I don't want to be able to invite other people to not generalize, right? Not generalize that because I've seen one experience of therapy, all therapists must be the same. All mental health counseling must be the same, right? Because it isn't. So kind of challenging some of those thoughts.
Thank you. So we had a question of the day, and some of our audience members have said they stay away from therapy, or why others might stay away from therapy is fear of adjustment and fear of being put in the system. Definitely, to your point, Camille, about this institutionalization. So for the record, what is therapy? And I guess also what is crazy? We throw the word around.
Well, I have to say, it takes a lot to be crazy. And most Black people are not crazy. They may be anxious, they may be depressed, they may be stressed, they may be bipolar, but that is not crazy. To be crazy, you absolutely actually have to be almost, the lay term would be you have to be out of your head. And the psychological term is that you have this break from reality, so that you can't distinguish real from fantasy. That's the type of behavior that as therapists, as psychologists, and Camille talked about the DSM, says is crazy. Everything else is just these life challenges, these mental health challenges that people experience, and that then what we traditionally think of as therapy, seeing someone that helps you, that assesses what are you experiencing, what are your symptoms. Now that we know what your symptoms are, now that we know how those symptoms are affecting you in your various spaces, what's the best type of therapy for you? So I might be someone who just can't give a talk in front of people, okay? And it's impeding my ability to do my job. So that would be known as social phobia. So I would go to therapy, Camille would assess me, say, oh, well, I'm looking at social phobia. And then she would sit down and talk to me about how we're going to address this social phobia. And then working together, which is the piece most people don't get about therapy, that you have to work in therapy. That the therapist just doesn't do everything. Then working together, we would begin to address the ways to reduce and overcome the social phobia. And there are different approaches that one takes. So you might take a cognitive behavioral approach. You might take a DBT approach. You might take an acceptance and commitment approach. You might take a mindfulness approach. No, rarely anyone does therapy in the ways that we used to see it done in the movies, where you're on a couch and the therapist is sitting there and taking notes. That therapy, that type of therapy, psychoanalysis, doesn't particularly work for the mental health experiences, for the mental health challenges of Black Americans.
So I want to ask you about that, but before I get into that, let me ask both of you. So there might be some people who say, okay, great. I understand that there may be people who need emotional support. I understand that, there are people who might just, need someone to talk to and process through things. But I'm a strong person, and Black people have always had to be strong. And so what doesn't kill me makes me stronger. So really, therapy is for people who aren't strong enough to deal with the things that are brought to them in life. What would you all say about that? Because I know that in some generation, even like in my family, like some of the older generations, even if there's sometimes things voiced, you might say, well, I'm feeling a little down today, or I'm feeling upset today. The reply might be, well, you need to go pray, or don't let that bother you. You're stronger than that.
Yeah, I think that one thing I because that comes up a lot with my clients. So I think one thing that I tell them a lot is that you can go to therapy and be strong at the same time, right? That they don't have to be mutually exclusive, that just because I'm seeking support from somebody else, it doesn't mean that I'm strong. Right? People who overcome challenges are strong, and going to therapy is just ways to kind of process and understand why I decided to adopt this kind of behavior, why I think I, do this and do that and think this way and think that way. And oftentimes what we see as negative behaviors or depression or anxiety and have a negative connotation to them are actually just survival tactics. That our body is doing exactly what it needed to do in order to survive difficult times. So to me, sometimes when I see symptoms of depression and anxiety, those are testaments that you've gone through a lot and you survived them. And that there's so much strength in saying, hey, this part I'm not sure how to navigate. Can you please help me with it? And just like Dr. Angela said, it is work. Right? So it does take strength to be able to go into therapy and have to navigate practice the skills and practice them in between session and do something that you're so used to. So if you're, 35, 45, or 55, you've been operating that way for those years. So to change that, right, takes a lot of strength. So I actually see it as someone who is strong and that they aren't, mutually exclusive.
Thank you. Thank you for that. Y'all, Camille has told us, you've heard it, that we are emotional creatures, that those emotions are just natural and it's okay for us to say, and also it's fine for us to take therapy and it's strong. So we have a good question. And this is from one of our listeners, and they said, what are your thoughts on taking psychotropics? So can you first tell us what are psychotropics or psychotropics, and what do you all think about them?
Psychotropics are medications, and they're specifically for various mental health diagnoses. And so what I would say is that the decision to take medication is up to the client. There are people who say, I'm not going to take any kind of drugs. And there are people who for generations, everybody's taken nerve pills, for example, which are so, but what I think is very important for people to understand is what medication does. Okay? And in most cases, it takes the edge off, the anxiety, takes the edge off of the depression. But what we know is that medication alone is not enough for many, many diagnoses, that you still have to do therapy. You still have to do the work. But for some people, it's just so helpful, particularly when you're looking at people who are highly anxious or people who are experiencing a major depression, which is depression that has lasted for 2 weeks. And you haven't been able to get out of bed, or that you're sad all of the time and nothing brings you joy.
Thank you. Thank you both. So, Dr. Angela, you said something I want to go back and let's unpack a little bit. You said that that rarely when people go to therapy is there, you're not laying on a couch and you're talking and someone's just taking notes and psychoanalyzing you. And one thing that you mentioned was that that's not really the way that most Black people will find healing and hope in terms of that. Well, you didn't say healing and hope, but I'm saying that type of therapy is not as effective for Black people. Is there a certain technique or a certain type of approach to therapy that's more beneficial for Black people?
I think it depends on what the mental health challenge is. So for anxiety, for depression, we're looking at some form of CBT, which stands for cognitive behavioral therapy. And that includes some mindfulness techniques as well, that falls under that broad rubric of CBT. If we're dealing with someone, there's something called borderline personality disorder. And if we're dealing with and that's people who, for 3 months they love you, and then all of a sudden for 3 months they hate you, is a way to think about that. So they do these push, they come all in and then they go all out, then they come all in and they go all out. And then we're talking about that, then we're looking at something called dialectical behavioral therapy, or DBT. So in types of the modalities or what type of therapy you get, those tend to be the better ones for Black Americans. But I also want to say that sometimes individual therapy is not the best for Black folks. And that's because of they may be leery about it. They may not know what to expect. So we do things like sister circles, and we do them out in the community. Myself and other people go out and train barbers and hairdressers in terms of things like stress, or in terms of what depression is. And so they're delivering a form of therapy. So there are different ways, there are not only different modalities, but there are different ways to receive therapy, individual, group. And then in my church, we have a wellness team, which are 4 mental health professionals. So we are delivering information and in some cases intervention to people who you talked about, those stoic older people who say, I don't need no psychologist, all I need is the Bible, if I just keep my eyes on Jesus, everything will be okay. And so as a wellness team, and there are other churches, at least I live in the Midwest, so there are other churches in the Midwest that are doing this as well, and finding it a successful way to deliver interventions to Black Americans.
Thank you. Camille, I know you also do you also do like group therapy, or you also work with that. Can you walk us through, like, say we were in group therapy, what is that? What does group therapy look like for those who, as Dr. Angela said, who might be more comfortable in a group setting rather than an individual setting? What types of things do we do in group therapy?
Sure. There are also just different types of groups as well. So with group therapy, there's usually different kinds. It could be it's usually a closed group. So there are a certain number of people who come into the group. No one else could come in and drop in. And that really protects the confidentiality of the group as well. Now, that's not always guaranteed. We encourage people and other clients in the group to make sure to keep everything confidential, but that doesn't necessarily always translate as opposed to the one-on-one individual therapy, just by the nature of what it is. There just happens to be more people, and they happen to know people and live their life outside of therapy. So there's that. But what happens is there's some psychoeducational groups. So just like Dr. Angela mentioned, the CBT and DBT, it's giving more behavioral techniques on what do I do when I feel stressed? How do I have an assertive conversation with my boss? What do I do how do I manage conflict? How do I self-soothe whenever I'm feeling a really strong emotion? So those are actually ways. And then there's also a process therapy group where you're really just going in and talking about what's on top of mind and what's going on for you, and sharing that experience. It's in the healing. The healing happens when you start to relate, to see that I'm not alone in this. When somebody else can provide comfort and say, hey, I've been through something similar. And that happens in kind of grief groups, right? Or specific, maybe postpartum therapy groups. So there could be specific topics in that as well that surrounds the nature of the group. So those are just a few. There's also a lot more.
Okay, thank you. So we have a couple of questions. One is, our listeners really would like for both of you to say a little bit more about post-traumatic stress disorder, PTSD, and how it relates to Black Americans, because really thinking about what we've learned from you all today in terms of history and how we manage emotions, is that PTSD? And we know that there's a book that's, post-slavery disorder, and there's just so much pain and struggle that comes along with being a Black American in this country. Can you all speak to that, or give us what's coming up for you all when we talk about PTSD and Black Americans?
We do a lot of treatment in PRADA, which is the Program for Research on Anxiety Disorders among African Americans, in terms of post-traumatic stress disorder. So first of all, it's important to understand that trauma is, in PTSD, you're looking at life-threatening trauma. And trauma is often life-threatening. And it leaves this wound in people. And so some people trauma, and they have high levels of stress, or they become depressed, or they become highly anxious. In post-traumatic stress disorder, what happens is people tend to relive that traumatic event over and over, and so they get these intrusive thoughts or these intrusive flashbacks of the trauma. Some people actually have what's called dissociative amnesia. So they lose blocks of time and they don't know what happened. In fact, they've been doing things that actually seem to be protective from, or to protect others from the trauma. There's a numbness that goes along with PTSD as well. So that's some of the symptomatology. In our work, what we find is that people have multiple traumas. And that tends to worsen the PTSD when they have more than one of these life-threatening events. And so there are various ways to treat PTSD. We opt for a brief way to treat it. So we use 5 sessions, and we use something called written exposure therapy, or WET. And we've been very successful with this, particularly with pregnant Black women, that we found that it is extremely helpful. There's also something called the ACEs, and I don't know if the audience has heard that term, which is adverse childhood experiences. And there's 10 of them, and more than one is, one is bad enough, but more than one is even worse. And when we look across the country, Black folks tend to have more than one. In fact, the average is like 3.5 that Black Americans have. And many of these items on the ACEs actually are traumatic events and actually play a role in post-traumatic stress disorder for these individuals. And the last thing I'll say is that a lot of times we got PTSD, we just thought, okay, it's veterans, it's people who were in the military and had to do and live through a war. But what we find is that to be Black in America is trauma, and that many of us meet criteria for PTSD.
And you explained that really well, Dr. Angela. One other thing I wanted to add is that you yourself don't have to experience the trauma to have the PTSD symptoms, that you can also witness the trauma and experience PTSD symptoms as well. So that occurs.
Yes, and that includes video. So it's not witnessing it live. When we see these videos played over and over again on social media or on our TV set, that can trigger PTSD.
So how do we know what's the difference if we're just maybe like going through a phase, or just, like on one, or just like, you know what, I'm just not feeling it, and don't worry about me, I'll be okay, versus real symptoms, like what are some things that can be happening in our bodies or happening with our emotions that let us know we might really need to seek some emotional support, rather than just maybe letting it pass or using another coping mechanism?
For me, with my clients, I look at the period of time of how long they're experiencing the set of symptoms. It is very normal to respond to grief or trauma or any life transition or change. It is absolutely okay to experience sadness or anger or frustration. So I want to again normalize that experience. So if it's happening for a long period of time and it starts to impair your quality of life, if it starts to get in the way of how you relate and your relationships with other people, if it starts to impair your work, and those are some of the kind of factors that I really assess with my clients and see, okay, this is really bleeding into other parts of your life and it's difficult to manage the symptoms, then that's where, we kind of go into that treatment with regards to PTSD.
Thank you. And so what about, so if we want to learn more about WET therapy or PTSD or options that are available to us, what are some good resources just to do personal research so we can, make some decisions, or just even know how to ask questions when we are looking for emotional help and support?
So I would recommend two places. There's a PTSD clearinghouse. If you put in Google PTSD clearinghouse, it'll list all the therapies that have been approved for treating PTSD. And it has all sorts of resources as well. Then there is a woman who specifically focuses on Black PTSD and the treatment of Black, not only research on it, but the intervention, the treatment of it. And that's Dr. Monica with two M's, with two N's, Dr. Monica Williams. And her website is drmonicawilliams.com. And she's actually developed an assessment that's specific to Black Americans, so that we can looks at race and racial trauma as well. So again, it's Dr. Monica with two N in Williams.com, and a lot of resources for Black Americans and Black Canadians because she's at the University of Ottawa currently, on Black PTSD.
Thank you.
Oh, I just wanted to add, just because I think it's important. Is that okay, Leslie?
Yes, please.
Just add a few more resources. Dr. Angela, you mentioned Therapy for Black Girls is another website. Another one to find the therapist is blackfemaletherapist.com. And there's another directory called Inclusive Therapists. And that is a directory that includes therapists who are either allies or identify as someone in the marginalized population. So those are just kind of resources to put out there for people to start the search.
And we're coming to the end of our time together, but I really want to ask at least one more question about what about if we just may not have access to therapy where we live, like maybe there are no therapists that we feel comfortable with. How can we find a culturally competent therapist if we are looking like online or using other means besides going in person? What are some good things to look for?
Well, I tell people that to find a good therapist, you need to approach it the same way you find a barber or a hairdresser. There's a reason the chair's empty. And so that one of the things you have to look for is someone who really knows and understands Black Americans, and that's called being culturally competent. And if they have never seen anyone who is Black, you need to ask, have you seen anyone who is Black? And if they have never seen anyone and they say, oh, no, but I'm trained in cultural competency, then no. Okay, then they have to at least have seen one person who is Black. Money should never be a deterrent. There are places and therapists who have sliding scale fees. If you are somewhere where there is a university, then and they train people to be therapists, then they have clinics. And while you're not being seen by someone like Camille or myself, you are being seen by graduate students who are supervised by people like Camille and myself. That's often free, or again, it's sliding scale. And then there's telehealth. And because of the pandemics, the rules about telehealth have been loosened and extended. So you can see via telehealth, via FaceTime or Zoom or Teams, you can see a therapist who lives in Ohio and you're out in California. But you really have to approach it the same way you approach your hair, because you're particular about who you let do it. And you ask really relevant questions beforehand. And finally, it's okay if you think if you've done your due diligence, you have your first session with the therapist and you say, no, this ain't gonna work. Okay, that's okay. You do not have to stick with that therapist, and you can start the process all over again to find a therapist who's a good fit with you. And finally, therapy doesn't take that long. You know, on average, people have 6 sessions of therapy. It's not that many sessions.
Thank you. Well, it has been, there's just been so much good information. Dr. Angela Camille, we thank you for joining us. So many things that we can think about, so many things to process. To those who have been with us, thank you guys for tuning in. So to close, I want to give you guys the last words. So if you could just say one thing that you want, one big takeaway that you want everybody to leave with from our time together today, what would it be?
For me, it would be to just get curious about your experience, get curious about your emotions, get curious about therapy. So that would be for me.
Thank you.
I would just say that there is no sin and shame in asking for help. The sin and shame comes when we don't ask, we keep it in, and we allow it to fester.
Thank you so much. Well, y'all heard it here. We've had an amazing discussion this afternoon, and walk away knowing that it's okay for us to feel how we need to feel. It's okay for us to seek help. It's okay for us to be who we be, to continue to be who we are. And also to know that being Black in America is, like we know, a trauma in and of itself. So be kind to yourself and give yourself some grace. So thank you again for joining us. And you can also access on our website the other parts of our series on generational trauma. So y'all take care. Thank you.